Putting myself back together has been quite a journey, but today I'm a new woman. Before, I was hopeless. It was devastating. I thought, I've had 3 surgeries. How many years of treatment? Somebody has to help me.
Strabismus is a condition where the eyes are misaligned. In E-Marie's case, she had a weakness of one of the muscles of the eye. When she was around 14, she saw an excellent ophthalmologist who attempted to realign the eyes so that she could use the eyes together. Unfortunately, it really didn't help reanimate or realign her eyes in a satisfactory way. After her first operation, she was under the impression that nothing else could be done. And in order to get her eyes working together, she had to take an abnormal head position in order to avoid double vision. And she has spent her majority of her adult life thinking that's the way she was going to have to spend the rest of her life.
From the time I was 14, I saw 2 of everything, and they changed when I moved my head. So my physical world was never stable. So it's very stressful. It feels like you're almost under attack by your physical world all the time. And at some point after that, I developed what's known as compensatory postures. So my brain apparently contorted my body to try to eliminate the double vision. I know I stuck my hip out, I would put my hand on my hip and curl over. By the time it was quite severe, I was 25. The only tolerable position for a good bit of my adult life was really laying on my left side. I went to doctor after doctor after doctor. I would see a neurologist. I'd seen how many orthopods. I've seen about 5 neurosurgeons, at least that many physical therapists. I've had 2 radial tunnel releases. I had a 2-level cervical fusion, and nothing lasted.
We realized that her neck pain was not due to a problem in her neck, but was due to a problem in her eyes. In order to see whether or not we can help with her abnormal head position, we used prisms in her glasses to see if we could simulate the way the world would look after we did surgical procedure on her eyes.
My body immediately straightened up, and that awful pain in my neck was gone. An ophthalmologist relieved me of that horrible neck pain that I'd had for over 20 years.
It's important to step back and take a broad look at the patient, to look at all her problems. It's very easy as a subspecialist to say, well, all your problems must be coming from the eye. Certainly her eye condition contributed to her neck pain, but before embarking on different surgical or medical procedures for the neck pain or the eye pain, I wanted to make sure that she was appropriately evaluated by the right specialist, whether that's physical therapist, orthopedic surgeon, or neurosurgeon.
E-Marie showed up to my clinic, and she told me that she had been seen by another doctor at Stanford for potential treatment of her strabismus. She also told me that she had some compensatory posture, and she thought that that might be contributing to her shoulder pain. At Stanford, there are so many other medical subspecialties, and we have access to each other as colleagues. We can contact each other and find the best fit for the patient.
It was kind of slam dunk for me, because by the time she came to my clinic, she had already seen ophtho and got the glasses to correct her head tilt. And because of the head tilt, after all these decades, she's basically wearing out her joints in her spine. And once she's straightened, that stress is no longer on the joint, and that process stops.
As a physician, our job is to make people feel better. Sometimes that's done by curing a disease. In her case, I can't cure her underlying neurologic problem, but I could certainly do something to minimize the burden of her disease. So if getting her eyes straight, taking her abnormal head position away, allowing her to keep her head looking straight into the future, I think it'll have a tremendous impact on the way she sees the world.
I became quite the medical mystery. Before, it had been one specialist after another trying to diagnose within their specialty, and Stanford unpacked that puzzle and put the pieces together correctly, and I'm a new woman.